You know the feeling? A headache starts to creep in. That familiar throb, that pressure, and almost right away, that little voice in the back of your head can start asking, is this, just a headache, or is it something I should actually be worried about? That question can cause a ton of anxiety, and honestly for good reason. So today we are going to pull back the curtain on all of it.
Okay, so that's the big question, right? How do we figure this out? Well, we're going to walk through exactly how doctors think about headaches, what they're looking for, and most importantly, what you can do about it. The whole point here is to replace that feeling of anxiety with some clear, practical knowledge. So here's the game plan. First, we'll cover the two fundamental types of headaches. Then we'll dive into the specific red flags that really get a doctor's attention. After that, we are going to bust a super common myth, arm you with a practical toolkit for managing your own headaches, and finally, we'll tackle that big question about brain scans.
All right, first things first. You need to know that pretty much every single headache in the world falls into one of two major categories. And really understanding this difference is the absolute first step in making sense of what's going on.
So on one side, you've got primary headaches. I love this analogy. Think of it like a faulty car alarm that just goes off on its own. There's no one breaking in, the alarm itself is the problem. This is where things like migraines and tension headaches live. There isn't some other dangerous thing causing the pain, the headache is the main event. And on the other side, we have secondary headaches. Now, if we stick with that car alarm idea, this is the real alarm. It's going off for a reason. Here, the headache isn't really the problem, it's a symptom. A warning light on your dashboard saying something else is going on. Could be an infection, an injury, a change in pressure in your head. This is the type that doctors are really trained to look for and rule out.
So here's the bottom line, and it's really good news. The huge majority of the time, we're talking over 95% of cases, it's a primary headache. Yeah, it can be totally miserable, but it's not dangerous. Secondary headaches are the rare ones, but they're the ones that could be serious. And basically, the whole diagnostic process is just designed to tell these two apart.
So, how in the world do doctors tell the difference between the 95% and those rare but serious cases? Well, they don't guess, they use a systematic checklist of what are called red flags. These are specific signs and symptoms that point towards a possible secondary cause.
And that checklist actually has a name. It's called SNOPN10. I know, it looks like a typo or a password you'd immediately forget, but it's an incredibly powerful mnemonic that guides how a doctor thinks. It helps them go through, step by step, and check for any signs that a headache might be more than just a headache.
Let's just zoom in on a few of the really crucial ones. The first O for onset, this is a big one. A thunderclap headache, one that hits its absolute peak intensity in less than a minute, that's a medical emergency. The N for neurologic symptoms is another huge one. If your headache comes with things like confusion, weakness, or numbness, that's a major red flag. And the other O for older age, if you get a brand new type of headache after you turn 50, that always needs a closer look. So just know your doctor is quietly running through this list in their head when they're talking to you. All right, now let's apply this kind of thinking to one of the biggest myths in the headache world. You feel that pressure in your face, right behind your eyes. Your nose is stuffy, so it has to be a sinus headache, right? Well, maybe not. Actually, get this. Studies show that about 90% of people who diagnose themselves with a sinus headache are actually experiencing a migraine. It's wild. What happens is a migraine can fire up the nerves that supply the sinus area, which causes that facial pain and congestion. It does a brilliant job of mimicking a sinus problem.
And you can really see the difference when you look at it this way. A real sinus infection, a true sinusitis, usually comes with stuff like a fever and that thick yellow or green nasal discharge. A migraine, on the other hand, often brings friends like nausea or being really sensitive to light and sound. And if there is any nasal discharge, it's usually thin and clear. Getting this one right is so important for getting the right treatment.
Okay, so we get the types, we know the red flags. Now what? Let's talk about what you can actually do. This is all about giving you the tools to manage your headaches better and have much more productive conversations with your doctor. The single most powerful tool you have, and I am not exaggerating, is a headache diary. And this isn't just, a list of dates. You track how often they happen, how bad they are, what meds you took, and any potential triggers. This data is the absolute gold standard for a diagnosis because it shows patterns that are just impossible to remember on your own. It's the best way you can help your doctor help you. And beyond that diary, these 5 habits are incredibly effective. Simple things, right? Staying hydrated, keeping a consistent sleep schedule, Yeah, even on the weekends, and not skipping meals can do wonders to stabilize your system and stop headaches before they even start. Oh, and be careful with painkillers. If you use them too often, say more than 10 to 15 days a month, you can actually start getting more headaches. It's a real thing called medication overuse headache. Which brings us to our final and very, very common question. Your head hurts. You're worried? Shouldn't you just get a CT or an MRI scan to be safe? It's a totally logical thought, but the answer, surprisingly, is often no.
And that's not just some random opinion. Major medical groups behind initiatives like Choosing Wisely are super clear about this. If your story and your neurological exam both point to a primary headache like a migraine, and there are 0 red flags, a scan isn't recommended. It's not likely to find a cause, it might expose you to radiation, and you might even find some random, unrelated, incidental thing that just causes more anxiety and a bunch of unnecessary follow-up tests.
So how do you have a good conversation about this with your doctor so you can decide together if a scan is right for you? Well, you can use a really simple but effective little tool called the BRAN framework. It's just 4 simple questions. B, what are the potential benefits of doing this test? R, what are the risks involved? Things like radiation or those incidental findings we talked about. A, what are the alternatives? For example, could we just use a headache diary for a while and monitor things? And N, what happens if we do nothing for now? Can we just do some watchful waiting? Using a framework like this really transforms the conversation into a collaborative decision, not just a demand. So, when you put it all together, understanding the difference between primary and secondary headaches, knowing the red flags that doctors are looking for, and having tools like a diary and the BRAN framework, it all leads to this. You are now so much more prepared to manage your own health and have confident, productive conversations with your doctor. And that, right there, is the real power of understanding what's going on inside your own head.